I'm pleased to welcome Paul Stern, who's head of the Midlands Cardiovascular and Respiratory Clinical Network, NHS England, looking at the importance of patient and public involvement in the work of clinical networks, patient representatives in clinical networks. Over to you, Paul.
Thank you very much, and very good afternoon, everyone. And can I just firstly say thank you to CCP UK for the invite to speak today. And I think also the opportunity to give a bit of a rallying call to anyone with lived experience of cardiovascular disease, whether that's as patients or involvement in other ways, to get involved with the work that we're doing as clinical networks, in particular cardiac networks, our focus today. So that won't just be for those of you in the room, but obviously those that will look at this recording further down the line. So I just want to take you back to January the 7th, 2019. Theresa May is our Prime Minister. Liverpool are currently top of the league. They went to lose by 1 point to Man City at the end of the season. And we're just over 12 months away from kind of the pandemic, and no one was at all prepared for the impact that was going to have on any of us on the planet. It's also the date that the NHS long-term plan was published. So this was the plan to set out the priorities for the NHS over the next 10 years and how we were going to go about delivering on those priorities that the plan had identified. And for those of us, I was with the British Heart Foundation at the time, so those of us that were involved with cardiovascular disease care in all forms, whether it was, as a professional or whether it was personal involvement, it was just fantastic to see and real satisfying to see that cardiovascular disease had actually been identified as one of those priorities within the plan. And it showed all the work that had happened prior to that plan being developed, and a huge of that was down to public and patient involvement, as well as third sector and clinicians, in ensuring that cardiovascular disease was there, along with stroke and respiratory, as a real priority for this period of time. I don't think I need to remind anyone in the room of why cardiac disease matters, but it is just worth just kind of showing this slide to say that 1 in 4 premature deaths still caused by cardiovascular disease. It affects 7 million people in the UK and has huge health inequality implications. So mortality from cardiovascular disease is up to 3 times higher in the most deprived of the population compared to the most affluent. So what were the cardiovascular disease ambitions set out in the long-term plan on January the 7th, 2019? Well, it was to prevent, over the next 10 years, to prevent 150,000 heart attacks, strokes, and cases of dementia. But also, coming back to this health inequalities issue, to reduce the gap in avoidable cardiovascular disease deaths between the most and least deprived areas year on year over that 10-year period. How are we going to achieve this? Well, it was looking at the whole pathway approach to managing cardiovascular disease, right from CVD prevention. So the year prior to this, what was Public Health England, I should say, what Public Health England at the time had already produced their ambitions around cardiovascular disease prevention. So the long-term plan continued to highlight and prioritise those ambitions, particularly around blood pressure detection and management, but also all those other elements of prevention. Looking to, alongside the prevention side of things, looking to increase the diagnosis of people with hereditary cholesterol disorders, to try and ensure that we can manage these individuals earlier on, rather than having to deal with the consequences of an event further down the line. Improving cardiac arrest survival. Optimising the heart attack path. So anyone that has had a heart attack has ensured they receive early access to the treatments, the most appropriate treatments, and the aftercare based upon their needs. To improve detection, identification of heart failure and heart valve disease, but also earlier on again in that disease process, so that people can be identified as having these conditions far earlier on, receive the care they require, and then also to be able to improve the quality of life throughout that disease process. And the one that's closest to my heart as a cardiac rehab physiotherapist, my previous life, was the expansion of cardiac rehab services to really increase the number of patients, not only going through cardiac rehab, but completing the process and really benefiting from a more individualised approach to their rehab. So that's all well and good, but how are you going to ensure that this can happen? This is huge transformation. How is this going to take place? So what you needed was a structured, formal vehicle, if you like, to bring together all of those key stakeholders that would be key to really delivering on this huge programme of work. So this is bringing together clinical leaders, non-clinical leaders, commissioners, public health specialists, programme and project managers, healthcare professionals. God, I've missed out hundreds of there. All, and what I have missed out, I should definitely mention, obviously, is public and patient voice, those with the lived experience. How can you bring all these people together to ensure that you're working together formally in a structured way to really deliver this huge programme of transformation? And this saw the kind of the rebirth, if you like, or the resurrection in some cases of cardiac networks. So 15 cardiac networks now across the country, across England. And they all work slightly differently, okay? They're all structured slightly differently, they're all hosted slightly differently, but they're all working together to deliver this same programme of work. And nothing really has changed much in these last few years around those priorities. For the last 2 years, those cardiac networks have been delivering what was the Cardiac Pathway Improvement Programme, so a national programme of work that was delivered regionally through these vehicles, the cardiac networks. This year, that has now become the Cardiac Transformation Programme. But as you can see on there, those priorities that we mentioned right at the beginning that were in the long-term plan, they're still there. There's been a few kind of amendments, if you like. There's been a bit that's been needed to be added in, particularly with regard to recovery from the pandemic, because we all know the impact that the pandemic had on cardiovascular disease, amongst other things. So we're having to reflect that a little bit in the work that we're doing in our priorities moving forwards. But actually, otherwise, those same priorities are still there for us to be delivering on as we move into this year. So, why do we need patient-public involvement? Why do we need those with lived experience to be involved in our work? Okay? And I was trying to find sort of the best way to kind of sum this up in a few paragraphs. But actually, I think the NHS England website does this quite nicely. So I thought it was worth sharing this and just reading through it. So participation by people who use and care about NHS services enable us, whether that's NHS England, commissioners, service providers, to understand and respond to their needs, including those people who have the poorest health. This helps us to improve access to services and reduce differences in health in different communities. It allows us to see things through the eyes of those who use services and to be innovative, leading to better use of taxpayers' money. And ultimately, public and patient participation helps us to improve all aspects of healthcare, including patient safety, patient experience and health outcomes, giving people the power to live healthier lives. So I think that kind of shows that there's no point in us trying to redesign services or transform services or look at ways things can be delivered differently unless we know that it's going to have that positive impact, that it really is going to affect in a positive way those people that are using those services. And it doesn't matter, even if we involve all the experts that we have across all of our different fields, unless we have those of you that are actually going to be using these services, accessing these services, unless you're there at the very beginning, really throughout the whole of this process, then it's not really going to achieve what we're setting out to achieve. I can't emphasise that enough. And again, maybe like I mentioned with the research, maybe there's lots of ways that we can improve upon that. And I think this is where we want feedback. We want to know how can we do things better? How can we improve the way that we use that lived experience that you have to really influence and inform the work that we do? But as you can see there, it is a real core component. This has been taken straight from our cardiac network specification. It is there as a core component of that work that we do to involve patients and communities in the planning and all of the work that we do. And we must be doing that. So this leads me on to how, I suppose, discussing how you can get involved if you're not already involved. And I suppose the easy thing to say is we have the NHS England website, very easy to access. There's a whole page on how you can get involved in all different ways, whether it's through the involvement we're talking about, or whether it's through research even, or through volunteering, etc. It also does offer some specific examples of opportunities as they arise. When I did have a look this week, there was nothing on there specifically around cardiovascular disease. So what I would suggest, if anyone is really, is interested, wants to get more involved with the work that's happening locally within your cardiac networks, would be to actually contact myself. Okay, so I can speak for the Midlands region. I can put you in touch with all the appropriate people in the Midlands. But we also work very closely with a lot of our other, or all of our other colleagues across the rest of the country. I can know for a fact that 2 or 3 of the different regions are working together at this moment in time to develop their patient public voice strategies, to really look at improving the way that we involve patients and the public in our work. So we can put you in touch. I'm very happy to put you in touch with the appropriate cardiac network managers or individuals that can then discuss the best ways for you to be involved in the work. And again, a bit like Holly said, we don't have a kind of a particular patient or individual in mind when we're looking to recruit to these bits of work. And it really, really depends on you as an individual, the experience you've got, the background you've got, the time you've got, your access to be able to travel or not travel. A lot of stuff that we do is obviously online now. And we would just encourage everyone to get involved, because there will be roles for everyone. So we have patients sitting on national and regional delivery and oversight boards, but we also have people just involved in far smaller bits of work that might be specific to a condition or an interest that person has. I mean, Roland might use an example, but cardiac rehab. Yeah, so Roland sits on our cardiac rehab steering group in the Midlands, and has been a fantastic member of that group. But also, even sitting on panels to assess funding bids when they come in. We've got a number of pots of targeted funding that have come down this year, particularly for cardiac rehab, but also for heart failure. And we need patients and the public on those panels to actually assess whether the proposals don't just work for the clinicians, but do work for those service users as well. So I would just encourage you to get involved wherever you feel you will give the greatest benefit to us, but also where you feel you will benefit yourselves the most. And so either get in touch with myself, get in touch through CCP UK, have a look on the website, but I would just end with a bit of a plea to say, we need you. We need you to get involved in the work that we're doing. And there's been some huge successes, not just within the Midlands, but across the whole of the country in the work that cardiac networks have done over the last couple of years. And there's a lot more really positive work to come. And we need your involvement to make sure that success is as great as it can be. So thank you very much, everyone.
Thank you, Paul. Of course, I should have mentioned that you'd been involved as a health service engagement lead with the BHF before, and also you're involved with the Heart Centre at Stoke.
I was for many years, yes.
Is that where you did rehab? I did cardiac rehab there. You were involved in the Stoke rehab, yes, because that was a big rehab centre, really.
It is.
Small world. It is a small world. So the new networks now, obviously you want patients to get involved in all sorts of projects. Do you get the patients together? Do you gather patient meetings to develop and share their experience as we used to with the original cardiac networks?
So I think the fair answer to that question is it will vary from region to region. And I think it's difficult for me to talk about regions outside of the Midlands. I don't think, if I'm honest, in the Midlands we're doing it as well as we could or should. We do have that involvement. It tends to be representatives on a particular steering group or a board, rather than actually bringing focus groups together or something like that. But as I say, one of the things that we're doing at the moment is working on, within a couple of other regions, is our patient and public involvement strategy, where we're working with our patient and public voice national team to really ensure that actually we're recruiting into these, not just these roles, but also these focus groups, etc., the best way we can. But I suppose this is what I'm saying at the moment, is to get in touch with myself personally, and then I can ensure that I'm passing your details to the appropriate individuals if it's not myself.
Do networks have a budget now for PPI?
Good question.
For these meetings?
So Yes and no. Yes and no. So we have various levels of involvement within NHS England for patient and public voice work, and it tends to cover expenses depending on the level of involvement. So if you're expected to attend a national delivery board, you would expect to have the expenses to attend that if it's in person. But if it might just be being involved in some of the smaller groups, then there isn't necessarily the budget for that. So I think it depends on your level of involvement. It also depends on the funding that we receive. So we receive a budget to deliver all of this work we've described. And most of that goes on our clinical leads and our programme staff. But ultimately, it's one of the things that we can choose to fund if the money's there. And we should be funding for
Holly.
Thanks. Obviously, there's the 15 networks.
Yes.
Yeah. Do you have an opportunity annually or something to sort of all meet up and present success stories or things that haven't worked or that kind of thing?
Yeah, not kind of in a sort of a formal setting at the moment. I mean, I think it's something that has been discussed. So we will meet together. So we've met a number of times recently over specific areas of work. So cardiac rehab's one where we all got together only last month in Birmingham from all across the country to talk about the cardiac rehab work that's happening, particularly in relation to the funding that was then going to be coming down to support that work. And the same's happened for sort of CVD prevention. So we have all met as regional leads, again in Birmingham, to discuss the work that's going on. But as kind of clinical networks, it hasn't happened yet. But there is a lot more kind of conversations and peer support happening between the networks to discuss with. I think it's something that we should be doing. Yeah, absolutely.
I think we probably need to move on. Thank you so much, Paul, and thank you for our questioners there. Thank you.